Hi, I'm Lindsay Cox, Director of Affordable Housing at SC Health. Today, I'm joined by Dr. Louisa-May Khoo, whose work in urban planning has supported Singapore in becoming an exemplary model for aging well and a recently named Blue Zone, an area recognized for the longevity of its residents. Dr. Khoo is now bringing her insights into the Canadian context as an urban planner in British Columbia. Thanks for being here, Dr. Khoo.
Oh, thank you very much for having me. I'm excited to be here.
At our recent housing event, Designing the Future, Scaling Innovative Housing Options for Older Adults, you spoke about Singapore's longevity policies and how changes in mindset, governance structures, and planning approaches are needed to better support older adults in Canada. The resounding audience response was, "How can we learn more?" I'm really excited to be continuing the conversation today. So Singapore has taken direct action to help people live longer, healthier lives in their communities. Can you give some examples of the housing and social infrastructure they've set up?
Sure. Well, Singapore is a unique model because the state takes care of a lot of the public housing in Singapore. So 80% of Singaporeans live in subsidized public housing. And the unique factor here is that 95% of them actually own these subsidized homes that they live in. So Singapore has moved away from the rental model that you see for social housing and subsidized housing in many parts of the world, but has gone with an ownership model for non-market housing. And what we can learn from Singapore then is that because they have the control over such a big population, they then are able to provide that cradle to grave approach in some sense to ensure that people's needs are better taken care of throughout the entire life cycle. So for instance, when they incentivize proximity living, they're trying to encourage adult children, for instance, to live closer to their elderly parents so that there's that mutual support. And so housing grants, for instance, are granted for adult children and vice versa. If the adults cannot let go of their children and want to stay close to their children, even though they've moved out of the home, they are able to apply for grants so that we are encouraging multi-generational living.
That's a really important point. Creating incentives and opportunities to foster intergenerational living. And so what would the funding model be like, for instance, for some of the pieces you just mentioned, that kind of rental model and looking at it more broadly for seniors housing focus?
Right. So let me maybe touch on some of the senior housing models that Singapore has. So we have the purpose-built type senior apartments, and some of these earlier models focused on really independent living. So it's very much akin to what we see today in Canada. But more recently, we've recognized that it's not just enough to support just to have housing for independent living. You actually need that supportive infrastructure, elder care centers integrated into the housing model itself to enable seniors to thrive. So one example I can think of is really the Kampung Admiralty model. So it's a purpose-built, integrated senior housing facility, but it has brought together 7 agencies to be co-located into one integrated development. And the interesting part of this was it never actually started as a senior apartment. It started as wanting to create a hospital without beds in that part of the northern sector of Singapore where Kampung Admiralty is. And so they were thinking, what can we do to co-locate with this sort of ambulatory center, the hospital without beds, what are the challenges that Singapore faces? And of course, aging was very much at the forefront of everybody's minds at the moment. So they said, how about us co-locating then 160 of these senior apartments together with this hospital without beds, right? And that can then be tailored to all of the needs that our seniors may need in terms of medical and community health care. But together with that, they put in all the social infrastructure. So you had, for instance, the elder care center, the supermarket, a child care center, a community garden, a community plaza, so that it's not just the hardware, but that the hardware creates the space for the activities and the programming to flourish, so that people can take part in these activities, can make friends easily, and they have, tons of things to do. Like they will spend their days in the community gardens and just these activities to keep them occupied, and it encourages socialities as well. The other model, but this is a purpose-built model that is still very much independent living. So the other model that I want to speak to also is the community care centers that have recently gone into a pilot phase. So they're actually not yet existent, so to speak. They are actually being constructed on the ground at the moment. And this was an idea that came up actually during COVID, where they saw how when people were isolated, especially seniors, how it really affected mental, physical, sociological well-being, right? And so the community care centers were really about pivoting to fill that gap, to ensure that it was not just about independent living plus activities, it was also about the assisted living bits that come in to help people with activities of daily living if they so required. So the service structure would be tiered so that people can move into these community care apartments as independent seniors, fully able to conduct their everyday lives, but are able to build on the service package and purchase, so to speak, these service packages as they age and as they need more help to so still be able to age in place in these familiar homes and neighborhoods.
I absolutely love that model. I think in Canada, we could learn so much from really bundling the services in a robust way to help support aging in place in ways beyond what we're currently doing. There's so much opportunity. So thank you for sharing about the community care centers and the elder care centers as well. This
Maybe let me jump in, Lindsay, to elaborate a little bit more on the funding model that I think you asked for and that I've kind of just
we have lots to talk about, Dr. Khoo.
Yes. So actually, the state actually builds and funds a lot of these apartments. But as I mentioned, people actually own these homes. So they actually purchase these apartments, subsidized apartments, usually on a 99-year lease. But for the senior apartments, senior housing apartments, they are actually sold on shorter leases, just recognizing that it's for seniors. And seniors actually have the ability to decide how long a term of lease they would want to purchase. So they have the flexibility of purchasing, say, 15-year leases to up to maybe 40, 45-year leases. And of course, then the amount of purchase price would vary depending on the lease that they purchase. And this provides, therefore, great deal of flexibility in terms of affordability, right? So I'm not purchasing the whole 99 years when I'm already 60 years old. I can then opt to just do 30 years. What the government of Singapore has also done is also to come up with something called the lease buyback scheme, which I think is a very innovative idea. So what happens if, and this applies to all the housing units that the government sells, not just the senior apartments. So if I am raising a family, I need a 3-bedroom apartment, for instance, and I buy this 3-bedroom apartment for a 99-year lease, and I live in it for 30 years, for instance. And so I have another 70 years of my lease in place. But by the time I reach 60 years old, I'm thinking, maybe I only need to live here for another 30 years. And I can sell back to the government the 40 years remaining of my lease that I don't foresee requiring. And what the government does is the government then monetizes this 40 years, allows you to continue to live and age in place for the 30 years that you so-called have already paid for, but they will pay you back that 40 years as retirement funds so that you actually are drawing a little bit more pocket money every month as you continue to age without actually needing to move away from the home that you've aged and you've loved, right? So I thought that that's really innovative and something maybe Canadians can learn from. The other um, area that I wanted to touch on was the elder care centers that have been mushrooming just all over Singapore, because just recognizing the tremendous need for seniors to continue to be engaged after retirement and during the day, especially when their adult children or grandchildren are in school. So the elder care centers then provide an abundance of activities to keep seniors occupied. And these are built by the state on what they call a build, own, lease model, so a BOL. So they build the facility, they own the facility, and then they lease these facilities to the elder care providers to be able to run these programmings for seniors, and often on 3+3+3 year terms, renewable. So I thought that that's also a great scheme, because then nonprofit providers are not saddled with actually the capital infrastructure, because the state actually takes care of that funding.
There's so many great points about those models. To me, such an important part of a home is having stability. And I think that what Singapore has done really well in is to create opportunities to build in stability for the people that live there, including older adults. So to know that you're able to stay in a rent-based home in your home and rent for 99 years, if you so choose, and pay that up front and then have it paid back to you is just a brilliant model when we're operating in systems where a 1-year lease is pretty common. So you're constantly thinking of, okay, well, what am I going to do after that year? You know, what happens if my landlord sells? What happens if you know, they need to renovate, or you know, and this is what we're seeing is creating more and more homelessness among our seniors, among our older adults. So I really appreciate the build own lease model too, to offer some different opportunities and to take some of the pressure off of the nonprofit sector in terms of coming up with that capital up front, but providing the much needed spaces to deliver the programming and services that are needed in the community.
Yes, you're absolutely right, right? And stability is such a critical factor, because it's very stressful to think about, oh, what am I going to do in the next 5 years or 10 years? And especially when you are having mobility challenges, physical challenges that you're already dealing with, and to have that mental pressure and psychological pressure is tremendous, right? And I think where we can alleviate those pressures, it is for us to make sure that regulatory systems, governance systems, capital infrastructure, programming is in place so that really seniors can thrive. We can expect them to thrive when we don't put in the ingredients for them to do so. So beyond the brick and mortar, I wanted to also say that the integration of the spaces where people can interact, for the socialities to happen, that's becoming critical as we plan for longevity, right? And sometimes programs maybe need to be curated, but you know, seniors are absolutely innovative when they want to mingle and when they choose to actually recreate in very diverse ways, right? And so I think once the infrastructure pieces are there, they need to be co-located with the social programming space so that what I call carescapes can take off, right? So for instance, the elder care centers that I mentioned, they are always co-located with active aging centers, a new concept that the Singapore government has come up with, where they target people like you and me, the 30s, the 40s, the 50s, but who want to partake in all these recreational activities at a community level, because again, they are subsidized, but they become foundational bonds that help as people age, and they become the social glue and the social care that happens beyond kin to kith, right? So it's friends, it's neighbors, and so on and so forth. And once we co-locate these centers, that mingling becomes almost natural, like you don't question it. And that, I think that is the aim of planners, I think, to be able to set the groundwork, right? So that those socialities and that magic can happen.
It's a preventative tool against social isolation, which I think is it's so important to create those opportunities. We're living in an era where social isolation is as bad or worse than smoking, or it's as commonly indicated as an issue. So we're deeply impacted. We're so disconnected. So I love that the active aging centers are focusing on not siloing older adults, but really creating opportunities to mingle and connect across the demographics.
Yes, and I think that really points to the hardware piece that I'm talking about, right? Because in trying to make sure we have a care landscape as we move forward in a super aged society, you need to actually meld the hardware, which is the brick and mortar, the software, which is the programming and activities, and with the hardware, which is what we have, right? Our kindness, our compassion. But that hardware really requires the brick and mortar and the programming for it to flourish, right? So let me give you an example if it hasn't become already clear how this works. And this is an anecdote that I heard during my research by this man who told me this story. And it goes something like this. He says, there is this man who is living with his son. This man goes to the neighborhood shop every day to buy beer. And he goes home and he drinks it with his son when his son comes home in the evening. And so he becomes a father and son bonding activity, sharing their day over beers. But as the father aged, he developed dementia, and so he stopped drinking. But he will still go to the shop nearby every day to buy beer. So the son one day went to the shopkeeper and said, my father now has this problem. When he comes and he buys the beer from you, he actually does not drink it. So is it possible when he buys it, I bring the beer back to you for you to refund the money? So in Singapore, it's not common practice. We have a really good refund policy in Canada, but it's not that way in Singapore. But the shopkeeper was very understanding and he agreed. So one day, the father did not appear at the shop as usual to buy beer. And so the shopkeeper calls the son. The son rushed home and he discovered that the father had fallen in the bathroom. So what this story actually shows is that integrated neighborhoods enabled the father to actually walk every day, ritually, to the nearby shops for that retail activity. It was a task that he needed to punctuate the monotony of his day. And so the hardware is important, right? The brick and mortar, because it enables the software, which was the commercial transaction, to happen, the relationship to build between him and the shopkeeper every day. And in the process, social ties had developed with this daily interaction, which also then led to the shopkeeper to then agree to the son's request, which was out of the ordinary, for the refund of the beer that the father bought, right? And so we can see that therefore the hardware and the software play significant roles, even though the interaction is actually very mundane, because they seed something, right? Something that is invisible as yet. They seed hope, they seed possibility. So when the shopkeeper felt that something was intuitively amiss when he didn't see the man that day, he cared enough to pick up the phone and call the son. So hardware is the trigger, but the hardware alone would not have been any use if it was not cemented by the foundational hardware and the software that was already in place for that carescape to materialize. So I think it comes back to everything that we do. When you ask how Canada can learn, it comes back to planning at the upstream level. How when we build purpose-built environments for people to live in, it's not just about the housing, it's not just for profit. It's really about ensuring that we intermingle the software so that the hardware can also flourish.
I think you've laid that out beautifully, and the essential nature of integrating those core parts to build community, to better look after one another, and to create more thriving communities and environments. We can't just put up apartments or condos without thinking about these things, or we're really just creating kind of a concrete jungle. We're not creating the heart of those communities where people can thrive. So I really appreciate those points. And I think you've touched on these different areas a little bit as you've been going along, but are there any solid outcomes from this work from the people and community perspective that you'd like to highlight as we're nearing the end of our interview today?
Yeah, I think so. So I think it is everyone's responsibility, right? It's not just the professionals, the people in government, or the people in social service, or gerontologists, the ones running the healthcare centers. We, of course, have a responsibility to put in place the infrastructure, but I think it comes down to every single person on the street to be able to keep a lookout, right?
Mhm.
Dementia figures, for instance, now are 1 in 10 for our senior population. I suspect that's a highly grossly low number because that's what is actually reported, or like it's in medical records. That figure is more like 3 in 10. And so whether it is the bakery or the pubs at night who suddenly see a wandering, senior, it is our responsibility to make sure that they are safe. So
Mhm.
Carescapes is practice, it is lived everyday lives. Thank you.
Oh, thank you, Dr. Khoo. That was so wonderfully said. And I think that you've given the listeners a lot to think about. So thank you for this energizing discussion. For anyone interested in connecting with Dr. Khoo or to access additional housing resources, please check out the details in the video description. Thanks so much for tuning in.
Thanks so much for having me.
Thank you.